Hereby, I open this academic ceremony in which Shivesh Anand will defend the academic thesis, Breaking the Silence, Nano-engineered Scaffolds for Tympanic Membrane Regeneration. May I invite you to present a summary of your study and the conclusions of your thesis.
Thank you. Dear Prorector, members of the Corona, friends, and family, in the next 15 minutes, I'll be presenting a brief overview of the work that I did during my PhD, which was focused on fabricating nano-engineered scaffolds for tympanic membrane regeneration. First of all, let's understand what's the tympanic membrane. It's a thin tissue lying at the intersection of the outer and the middle ear, and its main function is to capture sound pressure waves from the environment and transform them into mechanical motion. The tympanic membrane undergoes a lot of injuries that can go under a lot of injuries, ranging from inserting an earbud into the ear to a microbial infection. Here is an example of a microbial infection where the space behind the tympanic membrane is filled up with a fluid, which is then released through the tympanic membrane, creating a hole in there. Before I start talking about the different approaches that we applied for treating these tympanic membrane perforations, I would like to present a brief demonstration. Let's say tonight, after my PhD defense, we organize a retro party. If you come there with a normal eardrum or tympanic membrane, this is how you would expect to hear the music. However, if you arrive there with a perforated tympanic membrane, this is how you would hear the same music. That's nothing. Now, conventionally, there have been many different approaches that have been applied for treating these perforated tympanic membranes, and that uses autologous tissue grafts from the different parts of the body. With a tympanic membrane repaired using these conventional techniques, this is how you would hear the same music. Not that fun, right? This is where Tom, the tympanic membrane builder, comes into picture. Tom recommends 4 different steps for fabricating the tympanic membrane. The first one is identifying the right architecture, then is the material, then creating these tympanic membrane scaffolds which can safeguard the tissue from microbial infections, and finally creating an environment which can mature this tissue in a biomimetic fashion. During my PhD, my work was split into these 4 different aspects, which has been the guidelines of Tom. The first, where I wanted to understand what will be the right geometry for recreating the tympanic membrane. Next, identifying which will be the right biomaterials for recreating the tissue. The third one was to create these tissues with drug delivery capabilities so that they can be used to prevent microbial infections. And finally, and most importantly, to create advanced 3D culture environments that can help in maturing the tympanic membrane scaffolds in a biomimetic fashion. Before we jump into understanding more of these 4 different aspects, I would like to briefly go through the fabrication basics that were used during my PhD. The first technique that we applied extensively was electrospinning, which is a technique which uses high voltage to create polymeric ultrafine membranes, which was then combined with 3D printing or additive manufacturing, which is a technique which allows creation of precise fibers using computer-aided designs. The polymer that I used in this case was PEOT PBT, which is polyethylene oxide terephthalate and polybutylene terephthalate. The idea was to create electrospun membranes, which were then used for creating 3D printed fibers on the top. So for the geometry, as I mentioned, that was the first aspect that we wanted to identify. Despite being a thin tissue of less than 100 micrometers in thickness, the geometry of tympanic membrane is slightly complicated. It has outer epithelial layers and an inner lamina propria. The lamina propria is composed of radially and circumferentially aligned collagen fibers, which are known for the successful sound conduction by the tympanic membrane. So, radial and circumferentially aligned collagen fibers, we know that. But what are their exact roles? This is what we investigated during my first project, which was understanding what will be the right geometry of the scaffold that could be used for biofabricating the tympanic membrane. In this case, we used 4 different scaffold geometries, the first one being the control without any collagen fibers. Case 1 only had mimicking circumferential fibers. Case 2 only had radial fibers, and case 3 was a combination of the 2 arrangements. Overall, what we saw that as we go across the different cases, there was an increment in the mechanical properties, and gradually we resembled that of the native tissue. In terms of the in terms of the acoustical properties, we saw that all the scaffolds behaved very similar to the native tissue, which confirmed the clinical relevance of the scaffolds that we were fabricating. For the biological characterizations, we used human mesenchymal stromal cells, and in those cases, we saw that the presence of radial and circumferentially aligned fibers helped in aligning the cells, and then also subsequently, it helped in aligning the collagen which was deposited by the cells. So geometrical manipulation was proved to be important in guiding the mechanical, acoustical, and biological properties of the tympanic membrane implants, but it's not always possible to play with the geometry, especially for patients who don't need a full eardrum reconstruction, but a partial reconstruction. In this case, it will be more advantageous if we could directly manipulate or modulate the polymeric properties, and that's why we wanted to advance the copolymer that I used in the first paper, which was POT-PBT, by incorporating our carbohydrate-based filler into the polymeric network. For this, I used ketene nanofibrils in combination with the copolymer. Ketene nanofibrils allows 2 different advantages for the tympanic membrane reconstruction. The first one was in terms of the mechanical properties, both by tensile and indentation measurement, which is more relevant for the tympanic membrane reconstruction. We saw that the presence of ketene nanofibrils in the scaffolds allow a higher mechanical reinforcement. In addition to the mechanical reinforcement, we also investigated the significance of ketene nanofibrils in terms of the immunomodulation properties. At the moment, the biggest challenge of the artificial transplants or implants in the clinics are immune rejection of those transplants. So we wanted to create tympanic membrane scaffolds which are not immediately rejected by the body. So in this case, we saw that ketene nanofibrils allowed a downregulation of pro-inflammatory cytokines that have been noted to promote this rejection. The third aspect of my PhD project was to create these tympanic membrane scaffolds with drug delivering capacities. So far, most of the microbial infections that we have addressing the middle ear, they have been treated using 2 different approaches. The first one is systemic, where the patient takes an antibiotic orally, and in the other case, which is topical, ear drops are being used to treat the infection which the patient has. However, in both these cases, the patient is exposed to a very high dosage of the drug, which is not required for treating the infection. So our idea was to combine the 2 different approaches in terms of tissue engineering and drug delivery, so we can create patches which not only covers the perforation, but also provides the antibiotics in the right dosages. For this, I investigated 4 different electrospinning modalities, where the first mode was just the control electrospinning of the POT-PBT copolymer. Mode 2 was of blend electrospinning, where the drug, which in this case was ciprofloxacin, was directly dissolved in the copolymer mix. Mode 3 was combining the electrospinning with electrospraying of drug-loaded nanoparticles, and mode 4 was an integration of mode 2 and mode 3. The overall idea here was to either encapsulate the drug, ciprofloxacin, inside the polymeric fibers, or have them outside in the form of these drug-loaded nanoparticles. Overall, what we saw is that with mode 2, we were able to achieve a sustained release of the antibiotic over a period of 7 days. And with mode 3 and mode 4, we were able to achieve a burst release over a smaller period of time. So with a combination of these 3 different modalities, we could confirm that based on the requirements of the patients, we can deliver the drug in a patient-specific or in a personalized medicine manner. For the validation of these electrospun membranes that we fabricated, we performed biological studies in terms of antibacterial validation and using human mesenchymal stromal cells. For the bacterial inhibition, we saw that all these scaffolds were capable of reducing the inhibition of the growth of the bacteria, both gram-positive and gram-negative. And in terms of the stromal cells, we saw that there was no detrimental effect of including these antibiotics in our system in terms of the growth and proliferation of the cells. Finally, the last part of my PhD was to create these advanced three-dimensional culture environments which would allow the differentiation of human mesenchymal stromal cells towards tympanic membrane regeneration. We investigated 3 different routes in this case. The first route was molecular, where we played with different media compositions to understand what will be the right bioactive agents to drive this differentiation process. The next was hierarchical stimulation, where we used the presence of 3D printed fibers to understand if these 3D hierarchy can also in stromal cells. And finally, and the most innovative part, was using sound waves to mimic what we have in the native environment. So for the acoustic stimulation, we created a bioreactor which allowed the culture of the tympanic membrane scaffolds at an air-liquid interface, which partially mimics the environment that we have in the native tissue. And by applying sound waves from the top, we could create these different vibrations at different frequencies. The presence of the vibrations was confirmed using both computational and experimental characterizations, and we could see that at different frequencies, we could get different amplitudes of the vibrations. So yeah, so far we did get cool vibrations, but we still don't know how these can influence the behavior of the cells. For the behavior of the cells, we applied an integrated stimulation approach where we had the acoustic stimulation along with the hierarchical and molecular stimulation, and we investigated the gene expressions which are relevant for the tympanic membrane regeneration. Here I would like to highlight that of collagen 1 and collagen 2. Usually when there is an injury in the tympanic membrane, the human body starts producing collagen 1, and that's gradually turned over into collagen 2. And this is something which we observed during our stimulation approach as well, where initially we had the presence of higher collagen 1, which was then down-regulated with the stimulatory approach as the collagen 2 expression was elevated. So to conclude, I would like to summarize by saying that geometry plays a critical role in fabricating tympanic membrane implants by giving us the possibility to control the mechanical, acoustical, and biological properties. However, for patients where the geometrical manipulation is not possible, chitin nanofibrils could be used as an important agent to manipulate or modulate the mechanical properties as well as the immunomodulatory properties. In addition, we demonstrated that it's possible to create drug-loaded tympanic membrane implants which can be tuned for delivering the antibiotics in a patient-specific manner. And finally, we created 3D culture environments which could then stimulate the differentiation of human mesenchymal stromal cells towards tympanic membrane regeneration. I would like to end this presentation by thanking some of the key contributors behind all this work. First of all, my supervisors, Carlos and Lorenzo, along with all my colleagues at the Merlin Institute. I would also like to thank my collaborators within the 4 Nano Eardrum Consortium. Thank you all for listening. I would like to hand over to the prorector now.
Thank you very much for your very clear presentation and the summary of your work. It's now time to start with the opposition. And the opposition will be opened by Professor van Blitterswijk. He's Professor of Tissue Engineering at Merlin Institute at Maastricht University. And he was chair of the assessment committee.
Thank you very much, Paul Rector. Dear candidate, let me first of all congratulate you with the beautiful thesis which we have in front of us today. I must say it was a great pleasure to read the thesis. I should state it's voluminous, it's a thick thesis. Usually in science that is not necessarily a good thing, but I should say because of every layer of complexity that you add to your structure during the chapters of your thesis, the reader, at least I, becomes more and more excited while going through it. So in this case, it's certainly a positive matter. For me, it's also kind of a déjà vu, because it's almost 4 decades ago that I was supervisor of a PhD student presenting a PhD thesis on an alloplastic tympanic membrane. And as you probably know very well, that was the same polymer that was used as you used during a large part of your studies. This material was ultimately clinically implanted, and my first question to you would be, are you aware of that?
Yes.
And what was the outcome of the study?
So I think, highly esteemed opponent, thank you very much for your kind words and your question. Yes, I'm aware of the study. I think it goes back to 1992, early 90s, that study. Yeah. And that was one of our key motivations as well, because in that study, it was performed in an in vivo platform, first of all in a rat model, and it was demonstrated that the POT, PBT films actually helped in the tympanic membrane regeneration. Yeah.
But that's the animal experimentation.
Yes.
Yeah. I remember that the material was implanted in humans. Actually, I did not remember until today if that was published or not, but I discussed it with your supervisor earlier today, and he assured me that actually it had been investigated in the clinic. And my question again, were you aware of that? My guess is probably not.
That study, no.
No, it's not easy to find, because I searched for it yesterday, I couldn't find it, and I couldn't even remember if it had been published or not. Apparently it had, with intermediate results, I would say. But that particular material was made in a relatively crude fashion. It was solvent casting, where we would introduce a porosity by using salts, which would be added to the solution, and that would create pores. So the dimensions with you could play were relatively limited. So that's very different with what you were doing. Yes. Actually, when I go through your thesis, I see that you add so many layers of complexity that I think it starts to get close to art rather than science. But that's also positive, it's beautiful, but it makes me wonder. The thesis which I'm reading, as we are discussing it today, should I see that as applied research, which really drives towards a specific clinical application, or am I much more looking at what we could call fundamental research, where we are exploring the boundaries of possibilities of what tissue engineering can prevail?
Thank you for that very interesting question. I think personally I would classify this as applied research, because that's something which has been motivating me as well. How I see it is that every step that we take within the thesis, we try to go closer to the clinics. And something which I feel that we missed towards the end was actually an in vivo study, because every things are joined towards that. It's just that we have to apply that within an animal model and see how it works out. But overall, throughout the process, the whole idea was always to keep it very clinically relevant. Okay.
I didn't know what to expect as far as your answer was concerned. It could go both ways as far as I expected, but you consider this applied research.
Yes.
I should say I have my doubts. And that has to do with all the layers of complexity that you add. And in my personal experience, the more layers of complexity, the more challenging it becomes to get to a clinical application. And that's probably what you see here as well. By the way, that is not qualifying it in a positive or negative sense, because fundamental research allows other people to build upon what you have achieved. So it has just as much value as applied. But you state it is applied. Now, in your presentation, which you just gave, you show that you also work on patches. The idea is to use patches. But that's not what you show in your thesis, is it? In your thesis, we are looking at an entire geometrical structure with specific mechanical properties. Is that correct for me to understand it like that?
So within the thesis, what we do is we start with the full reconstruction, then we move towards partial reconstruction, identifying that in the clinics, the partial reconstruction is actually more prevalent. So we also want to target those patients. And then towards the end, we go back to the full reconstruction for the bioreactor setup. So the whole idea has been to cater to both kind of patients, understanding that the partial reconstruction is clinically more relevant at the moment, and we didn't want to miss those segment of the patients. So yeah, it has
so that means that you are aware of the fact that most likely a partial reconstruction will be the situation in the majority of the cases.
Yes.
However, the mechanical testing, the acoustical testing, you do on the entire device, so to say, the entire construct.
Yes, so when we work with just electrospun membranes, the idea was that they could be used as patches, and there, even though we make those measurements on the entire scaffold, the properties won't change even if we have a small patch cut out of that in terms of the mechanical properties.
Yeah, and that's exactly what I doubt, I should say, because I can imagine if you design a full tympanic membrane, which you do here, and by the way, I think it's very elegant and beautiful, but I don't think you can just cut out part of that design to use it as a perfect patch. To give you an idea, I think the mechanical properties of a fiber, of course, vary a lot depending on the length. Because if you make a long fiber, if you cut it into 3 pieces, it will become relatively much thicker.
Yes.
And because of that, relatively much stiffer. So I would argue if you cut out a segment, or more or less cut out a segment of a full synthetic tympanic membrane, you do not get the mechanical properties that you would have for the full membrane. Do you agree with that?
I completely agree, because the mechanical properties, for example, that we characterize or we are most interested in is Young's modulus, and that's an intrinsic property which will depend on the geometry of the design or the structure of the patches as well. So there will not be a direct correlation in terms of the values that we get, but the idea was to investigate these techniques and materials and see the trend, and based on those trends we can then optimize to get the right value based on the patch size and the dimensions that we're getting.
So then it seems that we agree on the fact that for a patch you would require different properties as compared to the full tympanic membrane.
Yes.
So now, as we also agree on the fact that in most cases we will be looking at a partial reconstruction of the membrane, because you wouldn't want to cut away the healthy parts.
Yes.
And then what would your design criteria become for the patch as opposed to the full tympanic membrane?
Yes, that's a good question. So for smaller patches, one of the biggest challenges is that we can't manipulate the geometry there much, because there we are looking at a segment which has a lot more complexity in terms of those radial and circumferential alignment. So I would focus more on modulating the material properties, and in this case, for example, we can change the different ratios of chitin nanofibrils with respect to the POT, PPT, and see how those changes can affect the mechanical properties, for instance. Along with that, if we go into the fabrication side, we could also change the properties of the polymer concentration, or even the fabrication properties in terms of the electrospinning parameters.
One step back. If you are substituting a relatively little part of a tympanic membrane, do you think the mechanical properties matter that much? Because the general membrane probably won't change, so it's only this tiny spot, or perhaps 1/5 of the total surface area, which would have different mechanical properties. If you think about the sound and the music that you made us here earlier on, what would the impact be? I'm sure a little bit stiffer patch is not going to have a major impact on the performance.
Yes. If the goal is just to entirely cover the perforation, then I don't think it will make much difference in terms of the mechanical properties. But if the goal is to restore the hearing that the patient had before the injury, then taking note of the mechanical properties would be critical, because if there's a mismatch in terms of the stiffness of the patch and the native tissue, then for sure the acoustical properties are going to be affected.
Yes, but the question is, of course, will they be affected in a significant way or in a rather insignificant way? My guess would be not very significant. Do you agree or do you disagree?
I would say it depends on the quality of life. For restoring back the same quality of life that the patient had, it would affect in a largely significant way. But in terms of clinical intervention, then I don't think it's going to have any negative impact on the health of the patient.
Yeah. No, obviously not on the, we would hope it would not have an effect on the health of the patient.
Yes.
That's correct. Do I still have some time?
2 minutes.
I have 2 minutes, okay. I wanted to continue actually on this discussion, because designing this particular patch is one thing, but you also need to design a method by which it will be implanted.
Mm-hmm.
But perhaps we can discuss that later. What I enjoyed is also the chapter on the acoustic stimulation. And you may know that we have been working on materiomics concept, where we introduce topography on the material in order to induce specific cell differentiation. In a sense, that's what you also do with the acoustic stimulation. Now here you focus on the mechanical stress induced by the acoustic stimulation, but at the same time you introduce dynamic topology. Can you see any parallels with the materiomics approach that we have taken and that type of approach?
Yes, for sure there is similarity in terms of what the topographical structure is created during the stimulation. But I think one of the biggest challenges there, differences there, is that with the topo chips, for instance, those topography is consistent throughout the culture period. But here we stimulate the cells and they're exposed to that topography for a period of a couple of hours, and then they go back to the normal, to the usual flat surface. Yeah. So these changes, I think, helps in kind of modulating between those topographical variations and then giving the rest phase. So it's like for the same cells to go to the gym, have the exercise, and then have a resting period. And I think that can have a positive influence when the cells...
Which is known from orthopedic research,
exactly.
that the temporary stimulation is sufficient. I see a response from the prorector now, so I would like to thank you for your answer.
Thank you so much.
And give the floor back to the prorector.
Thank you very much, Professor van Blitterswijk. The opposition will be continued by Professor Rory, Professor of Biomaterials at the University of Sheffield in the UK. Welcome. Thank you for being here. Floor is yours.
Thank you so much. Dear candidate, I would like to also congratulate you. Wonderful thesis. Really enjoyed reading it, and a lot of attention to detail, which was very good. So I'll start with my first question to you. You've spoken in your chapter 3 a lot about the cellular alignment and the effect of the various configurations that you have of your FDM deposited fibers. However, where you have a junction, you say yourself, or you've quantified it, that there is less cellular alignment. So my question was, I was wondering, how important is cellular alignment in a tympanic membrane? And also, if it is so, how would you mitigate the fact that wherever you have a junction, there will be a decrease in that alignment? So could you take me through that, please?
That's a very good question. Thank you so much, highly esteemed opponent. So the cellular alignment was one of our key considerations, not just for the growth of the cells, but the subsequent collagen that will be deposited, because the whole idea has been that as this polymeric implant is degrading over time, the cells deposit their own extracellular matrix, which are then aligned in the fashion that the cells were initially aligned. So that's where it is coming from, and that's why the cellular alignment does become important. And this was further demonstrated or observed in chapter 8 as well, where we didn't see an importance of hierarchy in terms of the cellular differentiation, but we did see that the presence of these 3D hierarchy did help in aligning the cells and the collagen that was deposited. The question about how we can mitigate the negative effects of the junction, coming from the engineering background, my first thought goes to the fact that we can modify our designs where we create these spaces where during printing we leave out spaces so they are not crossing over each other, because if we just somehow not create these junctions, there will not be the issue of cellular aggregation at these junctions. So that would be my first thought, that we could somehow change our design so we don't have the junctions. And the second thing which I would like to highlight here is that we could also play with the density of the cells that were seeded initially, because it might seem that we initially started with a higher density of the cells, which then resulted in accumulation of more cells towards the junction. But if we use a lower density, which is more homogeneously distributed, then we can again
mitigate that. Yes, that's a very good answer. I was wondering if you do not have the junctions, then you perhaps have a more irregular or an intermittent structure. And would that then affect your mechanical property adversely, do you think?
So the mechanical properties would definitely change. It won't remain the same. But when I talk about those design changes, I wouldn't want to make those gaps super big. There would just be that, for example, the circumferentially aligned fibers are passing through, and we have a small break over the radially aligned fibers, because right now they go over them, and that's why we create these junctions. But if we just create a tiny bit of space, then we don't have these overgoing places.
Overlaps, yes.
Overlaps.
Very nice. Have you thought of any continuous structures, perhaps, where you don't have a junction? Is that possible?
Yes.
Yeah, so that might be a mitigation, that you
Yes,
have a
indeed.
continuous fiber deposition and no junctions.
Indeed.
That might
Yes,
be
yes.
something you can think about in the future.
Yes,
Yeah?
and I think that would be very useful when we wanted to apply this towards the bioprinting aspects, because then we want to limit the layers, and because then the cells are going to be encapsulated within the gel, and we don't want these junctions where there are twice the amount of cells as compared to the other places.
Absolutely. And do you have any example of continuous structures? Do you know of any?
No.
No?
In my
Okay.
knowledge, at the moment.
Fibonacci structures, you could perhaps think of those sort of things, isn't
Yes,
it? Where
exactly.
there is no junction, really.
Yes.
And that might be nice to look at.
Yes, for sure. That would be something very interesting to look at these continuous structures which can still have the radial and circumferential patterns,
Yeah.
the combination of the two, indeed.
Fantastic, thank you. My next aspect was on your antibacterial work that you did. Again, very nice. You took the nanoparticles and you either immersed your electrospun fibers within the nanoparticle suspension, or you electrosprayed them on your structure. So I was wondering, since they are nanoparticles, why wouldn't you consider putting them within your electrospun fibers? What was the reason why you rather have them as a coating rather than within the internal structure of the fibers? Was there a reason?
Yes, there were a couple of reasons. The first reason was that since for electrospinning we have been using organic solvents, and the nanoparticles were PLGA-based nanoparticles. So as soon as we have them in chloroform or HFIP, the PLGA shell would completely degrade right away, and the drug would be released. So within our fabrication setup, using the polymer POT-PBT, it wouldn't have worked to include within the polymeric fibers. And the second approach was to design these scaffolds where we can show that with one approach we have the drug within the electrospun fibers, and with the other approach we have them on the top. So we cover both the bases as well.
I see, okay. So just as a discussion, we have done similar things, and what we did was we looked for a solvent that would be a non-solvent for one of them. Since you have two polymers, it's perhaps not difficult to find another solvent rather than chloroform that would work for your normal polymer, copolymer, and wouldn't dissolve PLA or the PLGA that you use. So that's perhaps something. And then it's I worry about the delamination of the particles when you put it in the ear. It's got a mechanical stimulation and everything. So having it within might be a little bit more secure. Yes, I understand the solvent. So you could perhaps look for one that is a non-solvent.
Yes, I think that's a very good idea also in terms of slowing down the release from these nanoparticles, because with the nanoparticles we could only achieve a burst release, but if we had them encapsulated somehow within the fibers, then that would also be one of the advantages that they will have.
They would. It'll be very controlled and long term. Do I have time for one more? 2 more minutes? Okay. So my last question, Shivesh, was I was looking at your MIC values that you quote, and somehow there are 2 values quoted in the 2 chapters. Perhaps is it that the MIC value is different in an air environment as opposed to a generic MIC value for ciprofloxacin? Is that why? I have the values here, but they were significantly different. One is about a microgram, 0.25 to a 1, and the other one quotes 3. So I was wondering why this difference.
Yes.
And one little thing more was why the MBC, which is the bactericidal, the minimum bactericidal concentration, rather than the inhibitory concentration, wasn't considered, because you want to kill the bacteria, not just inhibit them, right?
Yes. Yes. So to answer the first question, the proof of concept study that we had initially, that was just to test out the nanoparticles. And during that paper, which was back in 2020, we didn't want to highlight tympanic membrane as the key application.
Sure.
We mentioned just once in the paper that potential application could be tympanic membrane, but it was more generic with one particular application.
Sure.
Whereas for the second paper, which was entirely focused on tympanic membrane, patches for the tympanic membrane perforations, so those values are very specific for the clinics in the otological department. Sorry, the second question was regarding...
It's about the MBC value. So you, every antibiotic has 2 values. One is the MIC and the MBC. So the MIC is where it's inhibiting the bacteria, not necessarily killing them.
Yes.
The MBC is where you kill them.
Yes, yes.
And you've mainly considered the MIC,
Yes.
which normally we do, but we also keep an eye out on the MBC. So I was wondering, maybe you did and you didn't mention it, or?
No, to be very honest, we didn't consider that. And I think one of the reasons could be that probably for killing the bacteria, we might need a much higher concentration. And we were already on the verge of having a detrimental effect on the mesenchymal stromal cells that we had. So we didn't consider that during our research, and just focused on inhibiting the growth, because increasing the concentration might also then start happening the negative impact on the cells that we have in there.
Of course, yeah, that's always a balance, and
Exactly.
Sometimes they're very similar, so and sometimes they can be quite different. So that's true. Great, thank you.
Thank you so much for your questions.
Thank you, Professor Roy. The opposition will be continued by Professor Motta, Professor of Biomedical Technologies at the University of Trento in Italy, and Professor Motta is online. Welcome.
Thank you very much. Sorry to be thank you for the invitation, of course. So, dear candidate, I really enjoy to read your thesis. It's very well written, very accurate, very clear, and all concepts explained very clearly. Beautiful work. So, congratulations. I would like to start with some technical questions, moving then to more general. And first of all, if you can explain and discuss a little bit on the advantages in the use of a combination of synthetic and natural polymer together, and how then the impact on the degradation of the system.
Dear highly esteemed opponent, thank you very much for your kind words and your question. That's a very good question, that why we wanted to integrate synthetic polymer with natural polymers. And one of the key advantages of using ketene nanofibrils, personally for me, was in terms of the materials, how it is being extracted right now is through the food waste product. And I find it very useful that how we can use those food wastes to create biomaterials that can impact human health. So for me, that was one good motivation in terms of using these waste products into our systems. But in terms of the biological properties that ketene nanofibrils offer, it has been reported that it has immunomodulation properties and antimicrobial properties. Despite that, we didn't go much into the antimicrobial properties of ketene nanofibrils. We found that it offers a great mechanical reinforcement within our tympanic membrane scaffolds. So that was the idea of why we wanted to combine a polymer which has been extensively used for tympanic membrane regeneration for almost 4 decades now, with something more green and innovative, which is coming in the last few decades. So yeah, if that answers your question.
Yes, of course, of course. Sorry, the connection is not very stable. I totally agree with you, actually. So my question goes into chapter 5, and in particular, the rationale where no immune cells were used. Can you explain a little bit?
Professor Motta, maybe you can repeat your question because the sound was not very good. Can you repeat your question?
Sure. So my question goes into the work presented in the chapter 5, the inflammatory studies. And can you discuss a little bit the reason why no immune cells were used for the experiment?
That's a very good question in terms of the fact that we are working on the immunomodulation and we didn't use immune cells in there. The idea there was to have a proof of concept study where we could show that chitin nanofibrils does have immunomodulatory properties. And despite not using immune cells and using human keratinocytes, we could show that even on these cells, we were able to downregulate the expression of pro-inflammatory cytokines. So for sure, that is something which we would like to explore in the future and make it more relevant for the immunomodulatory studies, indeed.
Yeah, maybe eco-culture keratinocytes plus immune cells can give you some more details of the impact on this specific mechanism. And is it just a curiosity? You tested at the pH in between 7 and 8. This is the pH in an inflammatory environment in the tympanic membrane?
So for the tympanic membrane, since it's a tissue that's suspended in air, so we have air-air interface on both sides, it's hard to judge what is exactly the pH in that environment because there is not solvent around. And that's why we just went ahead with that pH, which is closer to the physiological pH of the human body.
Yeah, I was curious to know this aspect. Thank you so much. The next question is going into the mechanical property. There was a very, very nice mechanical characterization. You already answered some question on this aspect. I would like to know if you did or you think should be done a mechanical characterization during or after cell culture to evaluate the impact on mechanics on cell adhesion and increasing population, ECM production, but at the same time, the material degradation. If you did, or what is your opinion on that?
That's something which is very, very relevant for the studies that we performed because all the mechanical characterizations that we did was on acellular scaffolds, so they were before the cells were cultured. And since during this project, the whole idea is that as the polymer degrades, the cells have to be producing their extracellular matrix. So it will be very, very important to keep an eye on how these properties are varying over time, over weeks, over months, ultimately when we get the mature tissue. So yes, that's something which we would indeed like to explore in the future and see if we are able to maintain the mechanical properties or if possible, even enhance the mechanical properties as the polymer is degrading because the cells have to be producing their own extracellular matrix in the aligned fashion which we want.
Can you think that this kind of evaluation of mechanical properties during cell culture can be integrated in your bioreactor? Can you do online?
So you mean while we are stimulating, we can make the mechanical measurements and then keep in culture?
No. This is very clear to me. If you can check the variation in mechanical properties during the cell culture, just to see in real time how this can be changed because of the cell activity.
Yes. So I think with mechanical properties, it might be a bit tricky unless we use techniques like atomic force microscopy, where we go on the cellular level and see the mechanical properties. But something which would be very relevant and it's possible to do is using the acoustical characterization, which we did using laser Doppler vibrometry. And with that, we can measure the properties, the acousto-mechanical properties of these implants while they are in culture. And then, yeah, we just have to make sure that everything happens in a sterile environment. But technically speaking, it is possible.
Okay, thank you. I would like to go back to the discussion on the complexity of your system. So did you consider the reproducibility of your processing methods and possibly the scaling up thinking to a translational aspect to move your system to the clinics and to the market?
Yes, so we did make some efforts to take this study a bit forward in terms of incorporating in vivo studies. We tried to establish a collaboration where we shipped some samples which could be used in a rat model. But then the problem with these small animal models are that the tympanic membranes are even smaller, and it's hard to perform these studies. Unfortunately, we couldn't establish a collaboration where we could work on big animal models, because that's something which would be very interesting, and see how these scaffolds translate there. Yeah, I think from there, we take on what market potential it has. In terms of the other aspect that we are currently exploring is for the acoustic bioreactor, which we got a patent very recently, and we want to explore if that setup could be used for culture of these systems.
Thank you very much. As a last question, can you briefly underline which is, in your opinion, the main contribution given to the field with your thesis work?
That's a tough question. I would say, for me, the biggest contribution would be in terms of putting all these different aspects of tympanic membrane within one book, because usually you could either just focus on geometry or then just drug delivery or just bioreactor setups. So I think putting all these very different aspects of tissue engineering for one single tissue and showing how this could be progressed to the next level would be one big contribution from my side.
Thank you very much. I'm fine. From my side, I don't have any other question.
Thank you very much, Professor Motta. Then we come to our last opponent. Unfortunately, one of the opponents is not here because she is sick, I understand. So we go to the last opponent, is Dr. Wieringa, Associate Professor, Neural Engineering at Merlin Institute at Maastricht.
Thank you very much, Pro-Rector. And dear candidate, I'd like to congratulate you and also your team on what I consider to be a very nice and exemplary thesis. I think it really embodies very well what we try to achieve in tissue engineering, where you start from design, some modeling, experimental corroboration, and also an iterative loop. And I think it's a really, really nice example. It was really nice to see everything in one package. So that being said, and also it was indicated there's quite a lot of details. I'd like to kind of start with some details on electrospinning, as you might expect, as a fellow electrospinning nerd. And in chapter 3, and I'm going to kind of start softly, you mentioned, or you show that if you look at your fiber production, you went through the generic parameter sweep, and you show that at 12 kilovolts, you have a very narrow distribution of your fibers. And you chalk this up to the Taylor cone, et cetera, but I was wondering if you could explain that a little bit more in depth. Right? This is a very complicated process, and I was wondering if you could kind of really explain why you think you have a narrow distribution in that particular voltage regime.
Thank you, highly esteemed opponent, for your kind words and the question. So regarding the electrospinning parameters that we optimized, one of the key aspects that we always look at is the formation of the Taylor's cone, where initially you have a droplet of polymer coming through, but then by applying a high voltage, this droplet is extended until the point where it's a perfect triangular or conical shape. And the best case scenario is when at the tip of this cone, you have a whipping phase where a single jet can be electrospun on the collecting surface. So visually, one of the first things that we do is to make sure we get the voltage right in terms of getting this cone. And then in terms of quantitative characterizations using the fiber diameter measurements, we did want to see if when we do obtain the Taylor's cone, are the fibers very homogeneous in the distribution? Because if we don't obtain a Taylor's cone, then probably there are multiple jets coming out from the same spinneret, and in that case, the dimensions of different fibers will not be homogeneous. However, if we have a single jet coming from a tip of the cone, then the fibers will be a lot more homogeneous. So that was the idea behind.
Okay, no, that's a nice explanation. So yeah, you have a more homogeneous because you have a single jet, nicely formed Taylor cone. So then, why then does it seem that you have an even narrow distribution when you start to spin on top of a mandrel?
Sorry, I didn't get it.
That's right. Why does it seem then in what you show that you have an even narrower distribution when you spin on top of a mandrel, on collecting onto a moving target?
Yes. So that was something. This was performed with a collab with help of a master student, and that was something which we wanted to investigate if rotating the mandrel will have an influence. And initially, both of us were skeptical that it shouldn't because the rest of the parameters are same. But we did have an influence, and then going back to the theory, it does make sense because if there's a single jet which is being electrospun and rotated on a mandrel, there's a higher chance that it's being pulled through, and that would result in smaller diameters and probably more homogeneous as well. So yeah, initially we were skeptical about that as well, but it does make sense in the end.
Okay, so there's a bit of a mechanical drawing process
Exactly.
that you're kind of tapping into, and that's making everything nice and
Yes,
and more close to the same dimension. Yeah?
exactly. Yeah.
So actually, feeding into that a little bit, I'd like to move to chapter 4, where here you have the inclusion of chitin nanofibers, which is for mechanical reinforcement as well as the antimicrobial or anti-inflammatory properties. But here you also see a narrowing of your distribution of your fibers, and also they become much smaller.
Yes.
You actually attribute this to the charge that the chitin imparts to the solution, this change in charge, positive charge, I believe. I kind of would politely disagree with that interpretation, because one of the things I notice is that you use PEG as a sort of a homogenizer so that you have a kind of a more dispersed distribution within your polymer solution. And I was wondering if I could ask you why I might be disagreeing with that.
Because you think that the PEG would also have an influence, because once we have the chitin nanofibrils and the PEG composition within the polymeric mix, then the PEG is dispersed as well. And PEG being more hydrophilic and softer, which will result in lower viscosity of the polymeric solution, and that can result in formation of smaller fibers.
So there's also something to be said for the fact that your PPT also basically has a PEG segment.
Yes.
Right?
Yes.
And then the like begets like, so you'll have PEG against PEG. There's a mechanism in electrospinning which is required, which is chain entanglement. So then I was wondering if I give you that hint, if you can try to elaborate a little bit more and try to understand my perspective of why I think you might be attributing this to something incorrect.
Yes, so the chain entanglement is a property usually when it largely depends, it correlates with the viscosity of the polymeric solution. So either that can be controlled using the molecular weight of the polymer or the polymer concentration. And both these factors contribute to the chain entanglement. So if we have a lower, if we want a lower entanglement, then we could either go with a lower molecular weight or with a lower concentration. So in this case, the presence of chitin nanofibrils along with the PEG does help in lowering down the chain entanglement, and that can eventually result. Yes.
Yeah, so that's sort of what I see. And also if I take a look at the data you provide in figure 4.4, you see a very clear correlation, because when something that's not clear in the way that you've reported the values, then you have ratios of 50-50, 65-35, etc. But also you state later on that your chitosan stays constant
Yes.
So that implies actually that your PEG is decreasing.
Yes.
And with decreasing PEG, I see that there's a slight increase in your fiber diameter.
I see. Yeah, makes sense.
So there seems to be a little bit of this. Okay, but that was my delving into physics of electrospinning a little bit. I have to say that overall, you did a really impressive job in terms of developing your own techniques, I think, to assess your scaffolds, and I really respect that, building your own tools, your own jigs to be able to do these measurements, including what I called, as I was reading your thesis, you referred to it as well, the Q-tip mechanical test. But when you reported this value, and originally in chapter 3, you also referred to what's in literature.
Yes.
And you have a nice table there that shows the different forms of mechanical measurements that people have performed on tympanic membranes. So my first question was actually, are these mechanical measurements, are they all kind of this different sides of the same coin, or are they actually telling you something different because they are different forms of measurement?
Yes, that's a very good question. So for the mechanical characterizations, one of the things that we wanted to understand was also how it affects the native tissue using the same technique. However, in Maastricht, we didn't have access to a native tissue, so we had to rely on the literature. But then within the mechanical characterization of tympanic membrane tissues, there's a lot of literature available, but since everyone has their own setups and techniques, it's really hard to find the right value. And even for the more recent studies which have been using nano-indentation techniques, they have come to a conclusion that the tympanic membrane can be actually split into more than 50 regions with different mechanical properties. So it's very hard to say that this will be the property of the entire tissue. And with that idea in mind, that's why I selected 4 studies which were very closely resembling what we did here, and those were micro or macro indentation measurements. And that too, in plane, like the orientation of the measurement was also very aligned with what we did. And yeah, we came to the conclusion that these 4 studies resembles, and we took an average of those, because even within those 4 studies, there was a lot of variation. So we couldn't say that this is the best representation of the native tissue. For example, one study among them had strips of native tympanic membrane, the other had full tympanic membrane. So it was hard to say that we want to go with this one. Yeah.
So then actually that was going to be my next question, because indeed I saw that you basically made an average of that value.
Yes.
But they cover quite a range. It's
Yes.
it's 10 orders of magnitude difference.
Yes.
And, so then, do you really think that averaging that in terms of those values from literature is really a valid approach to then say, okay, well, this is what the value we have, and this is what we have from literature, ergo, we're close enough? Yes. Is that valid, or?
So the motivation for doing this averaging came from the recent paper that I mentioned, which used the nano-indentation technique to measure 50 different regions of tympanic membrane. And in the end, the conclusion was that depending on the region that you have, the values will change. So in the end, the average value would be this for the tympanic membrane. And that's why that was the motivation, that if this is how experts in the mechanical characterization of tympanic membrane are making the estimate, then probably we could do that as well.
Okay, yeah, so kind of going with the flow at that point. Yeah. And Prorector, do I have time for a few more?
You can ask one more question if you have one.
Okay, one more question. So then my final question is actually with respect to the degradation study that you did. First of all, I'd like to thank you for doing this study. This has been a question that I've had for quite some time. I think most of the data we have in literature on POT, PPT degradation is usually in a different format, not necessarily electrospun. But at least it's a very dedicated experiment that took a year. And I'd also like to recognize that to everybody here, that is a serious commitment. But that also highlights different aspects of things, right? So first of all, I'd like to question about the solution in which you did this and the condition. So you have saline at 37. You also have, I think, a pro-inflammatory in a different chapter as well. What is the relevance of that, considering actually where you're placing this
Yes.
membrane?
Actually, this question brings us back to the question of the pH, because the tympanic membrane is a tissue which is suspended in the air, so there's no media around it. So it was hard for us to have a media that can mimic the tissue environment in that sense. So that's why we went ahead with the physiological saline, which is 0.9% NaCl. That was the idea behind that.
Shivesh Anand, the time appointed for defending your thesis has passed. The degree committee will now withdraw to discuss the quality of your thesis and your defense. I request that you and your company await the results of our deliberations and our return in this room.
All right, please.
The PhD defense has now ended. The degree committee will debate the candidate's performance behind closed doors. This process usually takes about 10 minutes.
Long road to the south side, 7 miles in my rearview mirror. I know what it felt like. My goals only getting clearer. East side to the west side, no place like home. If it's questions that you've got, go the extra mile and that. On the line, I know you know that I can't read your mind. Years can't fly by now, don't waste all your time. Cause I'll go the extra mile. Long road to the south side, 7 miles in my rearview mirror. I know what it felt like. My goals only getting clearer. East side to the west side, no place like home. If it's questions that you've got, go the extra mile and that. On the dash, got my laces tied. Long road, I don't waste no time. Break rules because fate decides. With the team and we chase the light. I make a move, fall down, shake it off. I hate to lose, bad branch, break it off. No room for negativity, praise and love. Prepare for deep part cause we're taking off. Hit the mileage, traveling so far from home. Gathering knowledge, other connections. I put the time in to get everything I ever hoped for. It's a challenge and we all in. It's a better future that we go for. And even though these nights seem long, I know that I am never on my own. Know you won the battle once you've grown. South side, 7 miles in my rearview mirror. I know what it felt like. My goals only getting clearer. East side to the west side, no place like home. If it's questions that you've got, go the extra mile and that. Long road to the south side, 10 miles in my rearview mirror. I know what it felt like. My goals only getting clearer. East side to the west side, no place like home. If it's questions that you've got, go the extra mile and that. Years can't fly by now, don't waste all your time. Cause I'll go the extra mile.
37.
Shivesh Anand. The degree committee here present has assessed the quality of your thesis and your defense. In view of its positive verdict and taking into account your previous qualifications, the degree committee has decided to grant you the degree of doctor. Professor Moroni is authorized to confer upon you this academic distinction in accordance with Dutch university custom. I invite your supervisor to now take the floor.
All right, please.
Do you promise to work in accordance with the principles of scientific integrity at all times, to be careful and honest, transparent, independent, and responsible?
I promise.
By the authority vested in us by law, and in conformity with the decision of the committee here present, I hereby confer upon you, Shivesh Anand, the degree of doctor and grant you all rights attached by custom and law. As evidence of this, I now present you with the degree certificate signed by the rector, the secretary, and the other members of the committee, and affixed with the official seal of the university.
The laudatio will be held by your co-supervisor, Dr. Mota.
Dear Shivesh, dear Dr. Anand, what a ride. It seems that we have started this scientific ride a decade ago. Between your first email applying to a position open in my group, part of the 4 Nano-eardrum project, to do your PhD here with us in Maastricht, until today we have seen it all. After a successful interview of a highly skilled master student with knowledge on electronics and some passion of botany, not to study plants but to use their leaves to create vascular networks, Shivesh has experimented it all. So we thought at that time. The PhD trajectory was full of surprises and tons of learning experiences and experiments. Some with more success than others, but clearly with a great output, as greatly demonstrated in your thesis book and your presentation and discussion today. Maybe to start, let's make a brief ride of the first chapter. That first one is always a joy. After Shivesh's first submission to peer review of his first chapter, he was awarded with a tremendous task of answering all the reviewers' comments. This was done at perfection, so much so that the answers had the same number of pages as the original manuscript. This has prepared Shivesh for the subsequent chapters, which went much smoother and with gradually less answers necessary. Well, to be seen as one of the manuscripts is still waiting to see the day of light after today. This last chapter also led to a patent filed yesterday, which Shivesh also had pushed hard to make it a reality. This shows his determination to extend his impact beyond scientific publications. Let's hope we become rich soon, if not of wealth, be it of knowledge. Now we know how to write a claim and how unexpected a patent text can be turned into. Talking about text, Shivesh was never short of words, preferably written. Countless were the emails, endless emails, whenever he would not agree with a particular result, situation, or experiment. As emails were not sufficient, at least for the supervisors and some other entities, Shivesh used the power of argumentation when discussing things in person. All in all, the text depicted in this great book that you delivered today has several other books of stories to tell. Once upon a time, there was COVID-19, which in reality was COVID-19, 20, 21. This has also affected Shivesh's scientific progress, but with some determination throughout the night shift, he was able to progress to the extent possible at that time. COVID was being restless with humanity, but so were you, producing kilometers of electrospun meshes in the lab. Another story worth telling is the graphical skills mastered by Shivesh during his PhDs. It all started with a cover of a manuscript, which became a cover of a thesis. Certainly this was not enough, and since a picture is worth 1,000 words, Shivesh started investing his time on getting great illustrations to support his science. During your PhD in the Netherlands, it was clear that you matured even further in every way, from the technical to the emotional. Your resilience, lucidity, even when challenging difficult work-related situations, leadership, and proactivity, resulted in excellent results shown throughout the PhD, and this moment is an unquestionable proof of this. Your work was evaluated by world references in biofabrication, tissue engineering, and regenerative medicine. Achieving your doctorate is a logical sequence of a history of training and essential skills that you became expert with the interdisciplinary requirement known to these fields. I'm sure your postdoctoral position at the Aarhus University in Denmark brings you even greater responsibilities. We hope you continue to excel. I'm sure you will be able to tackle any situation with the skill sets built over the years. I wish to take also the opportunity to congratulate your family that traveled all the way from India here to celebrate this day. I would also like to thank you both for raising this young, now doctor, with strong education, respect, and values, essential for his success in life. I wish also to congratulate your better half, Mrs. Claudia del Toro, which was key in every step of this long bike ride. Without those amazing rides across the green fields of the Netherlands and beyond that resulted in movies masterpieces were key and essential to recover from long and intense research periods. Let me take a final moment also to thank the members of the committee for taking the time to read critically your thesis and for being here with us today. In particular, Professor Antonella Motta for connecting from across the world, Professor Ipshita Roy for joining us today from Sheffield, Dr. Katerina, which unfortunately could not be present, but I wish a full recovery soon, Dr. Paul Wieringa for joining the assessment committee, and the pro-rector, Marlene van Beck. I would like to thank also Professor Clement van Vlietenswijk for sharing the reading assessment committee. Thank you for being here today despite the demanding personal commitments in this period. Finally, I would like to thank your friends, colleagues, and scientific family for joining in person and online, and Dr. Serena Danti and the 4-Nano Eardrum project partners for all the support during your trajectory. Shivesh, Dr. Anand, I'm out of words. Hope we see each other soon after this great day, even if it's just for a guru chat. It was a pleasure to meet you and work with you. Keep in mind that life will always teach us several things, but so does science. The more you will travel around, the more you will find out. Thank you very much.
I like how you smile.
Dear Dr. Anand, also on behalf of Maastricht University, I would like to congratulate you with the degree you have acquired today. A very important step in your career. I'd like to congratulate your family, friends, colleagues. I'd like to thank all the members of the degree committee here present. I'm not going to repeat all the names because you have already been mentioned. I'd like to say to you that I really enjoyed the defense of today. You have been able to explain very clearly what you've done, especially for persons that are not familiar with this type of research. I really appreciated that. And I think I can tell you that the Greek committee also was very satisfied with the way you defended your thesis. You showed great mastership of all the topics, although they were very diverse. And I think you can be very satisfied with the way everything went today. This being said, we now come to an end of this PhD defense. It's time to relax for you after all the stress of defending, because I know that it's always a stress. And with this, I close this academic ceremony.
Thank you, everyone. It's really a pleasure. Thanks.